streaming this?
Yes, sir.
Thank you all for being here. We're here today to sign a successful package of House Bill passage, I should say, of House Bill 391 is amended, the Health Freedom Act. I am told that the first state to have done that is the Republic of Virginia, which passed the bill, I think, about a week ago, and the governor signed it yesterday.
Yes, sir.
And it's my pleasure to be able to sign this bill today. And I think as the health care bill vote, or deemed passed, or whatever they're going to end up doing in Washington, D.C., to continually add constitutional questions as to the legality of the bill and as to whether or not they followed their own procedures, let alone the procedures that are outlined well in Article 1 of the Constitution on how a bill is passed. I think are going to continue to add questions and give credence to the fact that states like Idaho and many other states are considering the Health Care Freedom Act, whereas it recognizes the sovereignty of the state. It recognizes, at least under the 10th Amendment, that the police power belongs to the states and not to the federal government. Hence, this is the first time we've ever seen a piece of legislation like this that demands of the population of a state that they take, mandates them to take certain action. You know, one of the reasons we don't have the federal government mandating car insurance is because that is a state prerogative and a state authority. So anyway, with that, it's my intention to now sign this bill. I think I got enough pins in order to make sure that every one of these folks that were involved in the passage of this bill and the exertion, establishment for us of our sovereignty and our states' rights have the opportunity. We'll open the floor to questions. Anybody have a question?
Governor, the bill requires the Attorney General to go to court to fight against any such provision if it's enacted at the federal level. Given our budget crunch this year, are you comfortable with spending taxpayer money on this fight?
Yeah, and Betsy, you know, I've had this question from several sources before, and I am comfortable with it. You know, much has been said about the tax gap, and why aren't we spending more money on the tax gap? We are spending what we think we can keep up with, and we are closing that tax gap. But we also recognize you've got to spend a little money to get a little money, or in this case, to save the state a lot of money. And plus the fact that we're not going to be in this alone. There's going to be many other states. There's going to be probably a lot of other establishments and institutions around the United States that are going to be in this with us. So I think to protect the people of Idaho, which is one of our first obligations as a government, is the right thing to do. Any other questions? Yeah, John?
Governor, you said that Virginia previously passed a measure, but my understanding is you may be the first governor to sign a piece of legislation into law.
Well, I hope so. I hope you're right.
You're not sure if that's the case?
No, I'm not, because I know there's about 30 other states that are at least considering it, and where that's moved in their legislative process, John, I'm not sure. But if I am, I'm glad. But let me remind you, I'm not the first governor, especially this year, to have signed legislation that's reasserting the sovereignty and the states' rights and the prerogatives of the states, having to do with firearms, South Dakota, Wyoming, Montana, Utah. You know, the surprise to me the other day was when I was talking to some folks in the National Governors Association, Wisconsin. I think it's Wisconsin, Vermont, and New Hampshire. Legislatures passed bills that said to the governor, that is our National Guard, that is not federal troops. And you're going to do what you can to keep those National Guard folks under your jurisdiction, under your authority, and keep them home. So obviously today we're talking about health care, but the many bills that are going through, once again, the state of Utah asserting eminent domain rights for the states over federal lands within the state of Utah. You know, are these things going to go anywhere? You know, many of the scholars would tell you, as constitutional scholars, law school folks, the ivory tower folks will tell you, no, they're not going to go anywhere. They can't go anywhere. But I'll tell you what, you get 36 states, that's a critical mass. That's a constitutional mass. And if we can agree on one issue in those 36 states, and as I think you already know, John, and have reported on that, the 10th Amendment article that Dave Friedenthal originated and went through the Wyoming legislature with, and I've asked our legislature to pass the same thing, which is to call for a constitutional amendment to reassert states' rights under the 10th Amendment and add some new verbiage in it so that it's very, very clear that with exception, not routine, with exception, the federal government should take action before the states. You know, it's pretty clear to the founding fathers that the states were to be the laboratories of the republic, and that we were to work on things, and with the exception of national defense and international trade policy and those sort of things, and arguments between the states. Those were the true priorities for the federal government, not health care policy.
Governor?
Yes.
I know you don't agree with this idea of a mandate from the federal government. What should the state do to make health care in the state more affordable to Idahoans who can't afford it?
Well, you know, I think within its means, you know, the first thing you have to do, and you've asked the right question, what can we do to make health care more affordable? This health care bill does nothing to make it more affordable. It answers to the insurance and it answers to pay the bills. It doesn't give us any more doctors. It doesn't give us any more portals of health care that can be offered. That's one of the things we've been trying to do in Idaho for 3 years, is build up our doctor population. We have the lowest per capita of doctors in Idaho as any state in the union. And so the more availability, the more access that you have, the more supply of medical attention that you have, that would seem to me to either smooth out the price and in some cases drive it down.
So are you asking the gentleman behind you here to somehow recruit more doctors to
We've
the state?
been talking about it, that we're under the WAMI program. We spent $37 million since I became governor. It started in the Risch administration and the Kempthorne administration, to add nurses and to add nurse practitioners and to add more stability and more supply to our medical providers in the state. So they've already done their job. We just need to keep it up. But I don't think, Simon, that I answered your question relative to what can we do to make it more available or affordable in the state. Our answer is not to make it worry so much about the affordability as to drive down the cost, work on affordability and just pay the bills, but to drive down the cost.